Medicine can be miraculous and also innovative. And this is one of the many stories where it really proves to be true. Let me kind of set the stage for you so you understand what we are about to delve into. So this is what we got. This is coming from Northwestern Medicine. Botox-like substance. This is the headline: brings relief to Ukrainian war amputees. So injections were made around nerves, and it eased phantom limb pain more than standard care 1 month post-treatment. This was a study that was done, and it involved 160 amputees treated at 2 hospitals in Ukraine. And this is just remarkable what this study found. I want to bring in for the conversation the senior study author, Dr. Stephen Cohen. Dr. Cohen, thank you so much for your time and talking about something that is just really remarkable when you look at what you found in this study. Let's start right there. How did this study come to be, and really how was the study then carried out?
Sure. Thank you for having me on. This is important to me. So I have a son in the infantry. I'm a retired Army colonel. I do clinical research. I'm director of pain research at Walter Reed National Military Medical Center. So when several doctors from Ukraine contacted me about the problem of post-amputation pain, I responded, and to make a long story short, I went into Ukraine and I hosted the largest medical conference in the country since the war began. And afterwards, when I met with, people from the Department of Defense, they wanted to include, Ukrainian war victims in some of our studies. So we have a study examining different treatments for post-traumatic stress disorder and traumatic brain injury, to design studies, but also to look at what they were doing and to see if there was a signal that it could be effective.
Talk about this part. So I'm reading this and it says post-amputation pain affects most amputees. So someone watching right now, maybe they've never been in a situation where they've lost a limb. Explain what that post-amputation pain really is.
So post-amputation pain is really a symbol, is really a syndrome. So there are different causes. You can have pain in the stump or residual limb that results from scar tissue, from severed nerves. You can have phantom limb pain, or pain that's experienced in the phantom body part, the leg that's no longer there. And that can also be from, the cut nerves. That could also be from like reorganization in your brain. So your brain has a representation of your entire body. It's called the homunculus. And, parts of your brain are used to getting signals from your legs or your arms all the time. And when you no longer have an arm or a leg, your brain changes. So maladaptive, changes that happen, or, failing to properly adapt. So having like a mismatch can result in phantom pain as well.
I would imagine, doctor, that by not having that limb and then experiencing this pain, it would make it very difficult for prosthetic use, for mobility in general. So tell me how this Botox-like substance helped so that people could maybe be fitted for prostheses, to be able to maybe move an arm, move that actual limb that isn't there anymore, but have the prosthetics there to assist them along the way.
So that's a great point. So, pain in the stump or phantom pain that's caused by these, cut nerves can really interfere with a patient's, ability to use or to wear a prosthetic. So botulinum toxin, has been studied for many different types of neuropathic pain, or pain that results from nerve injury. And most of the studies are positive. What it does is it inhibits the release of transmitters that are involved in pain. But what these studies have generally done is they've given the botulinum toxin like in sensitive areas, so just like under the skin, subcutaneously. Some have injected them into muscles. But what we did that was unique is we injected the botulinum toxin, or Botox, around the cut severed nerves, like the sciatic nerve and the femoral nerve. This is very similar to like epidural steroid injections. So if somebody had sciatica and they had inflamed, irritated nerves, you could give oral steroids or IV steroids. They don't work that well, and there are a lot of side effects. But if you injected them epidurally around the injured nerve, you can reduce the dose, reduce side effects, and have better and longer lasting effects.
So this study was published this Tuesday in the Journal of Archives of Physical Medicine and Rehabilitation. The study, how long was it done for? And then my follow-up to that is, in terms of these injections that you spoke about, these Botox-like injections, do you have to continue getting those?
So these are great questions. So we followed patients for 3 months, and what we found was that botulinum toxin injected around nerves, and also sometimes in the sensitive skin and muscles, was better than very comprehensive medical and surgical treatment at 1 month. But at 3 months, it was reversed. So comprehensive medical and surgical treatment is better. And this is very consistent with the findings from other studies that show that botulinum toxin definitely works for nerve pain, but it lasts in most people between 70 and 80 days.
Does this open the door for this to be used in any other avenues now as a result of your study's findings?
Yes. So, like I said, botulinum toxin has been shown to be effective for a wide range of pain resulting from nerve injury, including diabetic neuropathy and post-herpetic neuralgia. So it could be used to treat these conditions, especially conditions like pain after shingles or post-herpetic neuralgia, where it's specific nerves that are involved. The other questions that we're hoping to answer, and we actually have some of them, but they're not published. So what is the effect of repeat injections? Because anyone who's gotten botulinum toxin or Botox for anything, even wrinkles, it has to be repeated. So is the effect the same? Does it decrease? Or is it cumulative and increases? The second minor point that I want to make is because of how botulinum toxin works, it's possible that you have additive or even synergistic effects with other treatments. So, like, this is very similar to the approach that's advocated for chronic pain in general. It should be multimodal and interdisciplinary.
So with that being said, it sounds like you're not ruling out the possibility of future research of this botulinum toxin. Am I wrong in that?
No, you're right. We're looking at other treatments injected around the cut nerves called neuromas, and to see how they work. We're looking at that in Ukraine, and then we're also looking, and we have preliminary results about how the course of pain in the stump, residual limb pain, and phantom limb pain impact psychiatric measures like anxiety, depression, and quality of life.
Which makes sense, because now, maybe you're not having that pain as much, and you're able, if you have prosthetics, you're able to have a little bit more mobility than prior. So that makes sense. I do want to ask you a question related, but at the same time, a little unrelated. You said that you spent time in Ukraine, you went there. Can you just walk us through, what you saw? We've had people on our show over the course of, what has transpired there with the war. What did you see when you were there? And really, maybe you can explain what made you decide that this was something that you wanted to study and do to improve people's quality of life.
Sure. Just to provide perspective, and And the figures really vary dramatically between what's reported by the Ukrainian government, what's reported by NATO. But I think most people would agree that there is now over 100,000 war-related, amputees in Ukraine. So to put this in perspective, throughout the entirety of operations Iraqi Freedom and Enduring Freedom meaning Afghanistan, there were about 1,750. So this is a huge problem. And, you know, chronic pain, including from, amputation, especially in young people, it leads to all sorts of problems, psychiatric problems, substance use problems, you know, relationships dissolve, people can't work. So, I've done clinical research for a really long time. I'm president of ASRA Pain Medicine, which is the largest, pain organization in North America. And, this is very important to me. It's important to me, as a physician, scientist, and also as a former military member who has a son in the infantry.